So I think one of the major points that we have in risk stratification for acute myeloid leukemia is that we use something like binary decision trees for everything. So we basically have certain variables, genetic alterations that we know are good risk and ones that we know that are bad risk. So the issue here really is, I think, that largely oversimplifies how disease biology actually behaves in the patients that we see. So what we intended to do was to show that not only the variable itself, but also the kind of patient biology is dependent on how the context of the patient is and how the risk for the patient then in the end works out, right? So essentially what we did is we had a lot of data from pediatric and adult AML patients, looked at all the conventional risk markers that we have, and then sought to find out how age modulates that. So in the end, what we found out is that age is, of course, as we know, a big modulator, but not all of these alterations confer universally favorable or adverse risk in all of the age groups. So essentially, age is a large modulator for all of this risk, and I think that's just one of many factors that we need to consider when we look at patient biology.